Hello, everybody. My name is Daphne Ewing-Chow, and I'm a senior contributor with Forbes in the area of food, the environment, and health. And I'm joined today by María, Neira, who is the Director of Public Health and the Environment at the World Health Organization. And we are coming off in our discussions today very much right after the World Health Organization Summit on health. And I wanted to get a feeling from you. How did those discussions go? Why was a health summit required specifically surrounding the needs of SIDS? Obviously, we are in a context where we are in a state of a current pandemic. We have the ongoing high rates of non-communicable diseases among small island developing states. And of course, they're the ever-present threats of climate change. Why would you say that this summit was so timely, and how would you say it went?
Yeah, thank you, Daphne. It's true, the world is now going through different crises, the pandemic and of course climate change, which is affecting all of us. However, there are certain countries that are more vulnerable, more affected than others. And the small island developing states are part of those. There is a group of around more than 40 countries, which are in different parts of the world, but they share this common vulnerability. They are small, they are in the middle of the ocean many times, and they are terribly exposed to the problem of climate change and natural disasters that are occurring. And because of this special vulnerability, they are facing special health challenges. We thought that putting together their voices and joining the World Health Organization, we could make this health argument stronger. We could raise their voices, make it more present at the international fora, the political fora, and make sure that the reactions and the support and the partnership generated will be stronger as well. So the intention was raising their voice, making sure that everybody understands that they have a particular vulnerability while they didn't contribute at all to the causes of climate change, because this is one of the important things. And of course, what we want after that is more action and more support for this group of countries and helping them to be better represented at the international forum. Of course, it was not just the climate change. The challenge of their health systems being weaker and countries relying on tourism, therefore now the poverty and the economy is suffering. The issue of noncommunicable diseases, which is obesity, is affecting dramatically many of them, and the issue related to climate change and health. So we focus on these three ones, and we hope that by joining forces, we can be stronger.
And would you say that creating this platform for advocacy and to share their voices and experiences, this is some more instrumental for the change and decisions that are going to come out of COP26 later on this year?
This is one of the commitments that we will take the outcomes of this SIDS Health Summit and make sure that we will take it to the COP26 to use it as yet another strong motivation to do more action to tackle the causes of climate change. Imagine the anxiety of some of the people living in those islands, knowing very well what a natural disaster is about, what a cyclone, a hurricane, and knowing as well that there is very little they can do to tackle the causes of those natural disasters, this climate change. Therefore, their voices are very important to champion more action, to use their vulnerability and their own experience to convince the politicians that they need to raise their level of ambition on their targets to decarbonize our world. And I think this is what they want. They don't want anything special for them. They want simply to stop the causes, and they want help to adapt to the consequences of climate change that in any case are going to happen, and they need to at least make sure that they are more resilient and better adapted, because climate change is already affecting them.
Right. I was watching actually in the discussions at the summit. I watched the address from the Director General, and I'm just going to read a quote because it's something that's quite fascinating, and I think something that a lot of people have discussed and quite interesting, and I wanted to ask you about it. He says, despite these serious risks, and of course he's speaking about the risks that small island developing states face, SIDS have proven to be true health leaders, safeguarding the health and well-being of your communities, while at the same time catalyzing political momentum for the global health goals. Many of you have succeeded in preventing widespread transmission of COVID-19 in your communities. And I've been noticing this within the Caribbean and in many Pacific countries. Obviously not all, there've been various experiences, but there have been a lot of successes within small island developing states in terms of keeping COVID at very low levels, or in some cases, keeping it entirely away, while in the same time working towards making societies more resilient. Can you speak to this? How has this happened within so many small island developing states?
Yeah. No, it's true. They are facing three emergencies at least. One is an environmental emergency, a huge environmental emergency. Now an economic emergency, as many other countries around the world, but particularly again, vulnerable because of the highly dependence on tourism in some cases, and then the health crisis. And it's true that they have been coping with, they have been responding, doing their part. And as you say, some of the islands, they have proved that they can stop the transmission or control the transmission. They took very serious measures. They have very good results. Now they are struggling to vaccinate their population. They are trying to get more vaccines and fighting for it. But still, there is part of that response that doesn't depend on them. It will depend on the international actions and decisions that are going to take it. So that's the part where they are raising their voice and saying, okay, we can cope, or we are trying to cope with health challenges, but there are some that are beyond our control, and where we are asking you, international community, contributing to the emissions of greenhouse gases to reduce it. Other ways, the first to disappear are our own countries. And this is really very traumatic. So as I say, they are not asking for anything special. They are simply asking for people to stop what represents a major threat for them. So these are particularly relevant to the COP26, to the G20, to the G7, to the Nutrition Food Summit, everywhere at the international level, because they are kind of our sensor that things are not going well. You are on a small island, so you are very much at risk. So those voices needs to be well represented in the way that nobody will be able to say a few years or a few months from now, say, oh, we didn't know, we didn't realize it. No, you knew it, what was the threat for our countries, and still the action was not at the level of the threat.
Right. I like what you said about small island developing states being the sensor, because really they're the most vulnerable link within the puzzle, and you can see how bad things are by how they are faring in various crises. And I remember at the UNGA in 2019, Prime Minister of Barbados, Mia Mottley, spoke, and she said that small island developing states should be an example to the rest of the world on how to be climate leaders, what do you say to something like that? As you said earlier, you know, such a small amount of the problem, almost non-existent, was created by these countries, yet they're the ones dealing with the biggest problems. And now to be told, okay, well, show the rest of the world how it's done. Do you agree with this? And how can this also happen in the context of struggling economies and all of the other issues that SIDS face?
I think because of this vulnerability that they have, economy, environmental, and health, the fact that they are associated is already something very good. That's why in WHO we thought that creating this platform for health and the SIDS was something important to make sure that together we can be stronger, stronger, all of us. Second, the health argument is certainly another strong one, to raise your voice and say, okay, the health of the people is being affected. We have health arguments proving it. And we have something else which is very important, that the investments needed to be climate resilient or adapt for the environmental crisis are very common sense and good investments no matter what. I mean, there are the no regrets investments because they are good for preparing your health system. They are good to reduce the vulnerability of people to natural disaster. And in addition to that, I fully agree. They are kind of a thermometer of testing the intelligence of our global community. If the global community cannot see it, that and a small group of countries, of course, in terms of population, a very, very small percentage of the global population, but they are the ones telling you, hey, this is happening to me, you will be the next. So at least realize that we are your sensor, we are your thermometer of the temperature in the real sense of the expression. And if all of these cyclones or hurricanes can in few seconds destroy all of our well-being and livelihoods, realize that you need to react, you need to do more. If you don't want to do it for us, do it for yourself, because we are all in the same boat. So I think their front voices are particularly strong for that. And they have been very articulate and very strong on different fora. In 2017, WHO launched the Climate Change and Health Initiative at the COP. And at that time, Fiji was very strong and vocal, and he was with us, the Prime Minister, launching this initiative. Since then, many SIDS countries have been very articulate as well, very vocal in many of those fora, but still we need action at the level of the importance of the problem, and it's not the case at all.
Right. And I guess one of the areas in which there's been somewhat of a struggle, and you mentioned it earlier, during the pandemic, has been the distribution of vaccines. Obviously, the large, significant amount of vaccines have gone to a very small amount of countries in the world. How is WHO addressing this, and what is the current situation with that?
Well, I'm sure that you heard our Director General and other seniors in WHO very often raising this issue of vaccine equity, the unfairness on the distribution, how much WHO is pushing the so-called rich or developed countries to be solidaire, I mean, to ensure that the distribution will be fairer, to do an effort. We are putting efforts everywhere on helping on transfer of technology when it's possible, pushing for donations when it's possible, stimulating countries to share their vaccines. We are pushing in all sense, and I think the voice of WHO has been very, very clear and very outspoken, pushing governments to do more and putting on the table this issue of vaccine inequity and how important this can be in the medium and long term to all of us, because we need to get out of this crisis all together. The COVAX is part of the response, but obviously the plans and the dreams for COVAX are still dreams. We are implementing, but certainly not at the speed or at the number that we were hoping to be. There are many, many challenges, and the call for more support, more being supportive to each other and more generous is still there. Yeah.
So just to wrap up, I have one last question for you, and that it comes back to the summit that just concluded. I wanted to ask you on a personal level, what stood out the most for you, whether it was a story that was told. I know that there was youth engagement, whether it was a story that was told or a commitment that was made or something that made you feel optimistic. What would you say?
Yeah, I think they have an incredible dignity. That's what I thought. They were using expressions like, we are not suffocating. I mean, we want to fight. We are not just victims. We don't want to present ourselves as, we are drawing and please help us. No, we are fighting. And that was the positive part. I heard a lot of stories about hurricanes, cyclones, destruction, personal experience. Maybe all of the speakers, they have, unfortunately, very close personal experience about natural disasters. And still, they were talking about rehabilitation. They were talking about building health systems now more resilient. They were talking about sharing experiences on procurement, global procurement. They were talking about community engagement and how they are planning to go to the COP, to all of those fora and ask for more. So I saw a desire to fight, not just to complain, but to fight and to make sure that they are taken into consideration. And I heard an optimism as well, even if it's, they are optimistic. And I heard as well saying, we never contributed to this, so it's very unfair that this is happening to us, so you need to stop doing it. So I thought it was very strong and not, as I say, not just a victimism or passive description of the situation at all.